Hello everyone, welcome to my YouTube channel. Please, if you are new on this channel, do well to subscribe, like, and comment your thoughts below in the comment section. Please subscribe to my channel and hit the red notification button so if there's any videos uploaded by me, you'll be notified about it. Today we'll be looking at treating asthma in babies and toddlers. What is asthma? When we say asthma is an inflammation of the lungs, the airways of the lungs, inflammation of the lungs airway. As a result of this inflammation, asthma attacks and periods of difficulty breathing might affect the airways. Exercise, colds, and allergies are typical causes. In order to regulate inflammation, prevent triggers wherever feasible, and treat asthma attacks, medications are used to manage asthma. It can be challenging to diagnose and treat asthma in children under the age of 5. The main signs of asthma in newborns and young children includes wheezing and coughing, may be brought also by other illnesses. Additionally, children under the age of 5 cannot be reliably or easily tested using the typical diagnostic procedures used to determine how well someone is breathing. Some asthma management treatments available to older children are not advised for newborns and young children. Signs of asthma in children under 5. In children under the age of 5, common asthma signs and symptoms include cough. Number 2, when exhaling, wheezing procedures, a high-pitched whistle-like sound. You have shortness of breath or breathing difficulties. And 4, you have a tight, uneasy sensation in the chest. The severity of and patterns of symptoms may vary. You have nighttime sensations getting worse, short bursts of coughing and wheeze interspersed with symptom-free intervals. Symptoms that are common or persistent with episodes of worsening coughing and wheezing. You have sensational variations caused by common illnesses or allergy triggers. Asthma symptoms may be triggered or worsened by certain events. You have colds or other respiratory infections. You have allergy-causing agents such as dust or pollen, activity or exercise. You have feeding in infants, exposure to cigarette smoke, strong emotional reactions such as crying or laughing, gastrointestinal reflux, changes or extremes in weather. Asthma emergencies. Severe asthma attacks can be fatal and necessitate hospitalization. Children under the age of 5 may exhibit the following symptoms of an asthma emergency: breathing heavily, taking in air so forcefully that the stomach is sucked in between the ribs. And number 3, you have difficulty speaking due to breathing difficulties. There are various tests to diagnose and monitor asthma in young children. It might be difficult to diagnose asthma in children under the age of 5. The main symptoms might be a sign of another illness. A breathing test that gauges lung function can be used on older kids. But smaller kids may have problems following instructions and breathing precisely as needed, making these tests useless. Your doctor or an asthma expert will likely utilize a number of pieces of information to reach a diagnosis if your child is under the age of 5 and exhibiting symptoms that could point to asthma. You have the medical history. Your doctor will probably ask you several inquiries such as the ones listed below. Is there a history of asthma in the family? How frequently do symptoms happen? Your youngster is awakened by coughing at night? Are the symptoms connected to a cold or unrelated to colds? How frequently do respiratory problems occur? They last how long? Has your child had breathing problems that require emergency care? Does your child have any known allergies to pets, dust, pollen, or foods? Is your child exposed to airborne irritants like cigarette smoke? You have laboratory tests. Laboratory tests to diagnose asthma in children under the age of 5. You have blood tests, of which certain white blood cells such as leukocytes, eosinophils that may be raised in response to infections can be measured by your doctor. Also, you have a chest x-ray. When asthma is moderate to severe, an x-ray of the chest may show alterations in the lungs. It can be used to rule out additional situations as well. And you have your anaphylaxis tests. If your child is allergic to a potential or likely allergen, a skin or blood test may reveal this. Before we proceed, if you have gotten this far with us, please do well to subscribe, like, and comment your thoughts below. Thank you. Now we move on to asthma treatment in babies and toddlers. For young children with asthma, therapy objectives include to stop asthma attacks, reduce airway inflammation, typically with regular treatment. 2. To treat asthma episodes, take quick-acting medications. 3. Prevent or lessen the impact of asthma triggers. And 4. Keep your activity levels consistent. Your doctor will treat your child's asthma in a step-by-step manner. The objective is comprehensive care with the least amount of acute asthma attacks possible. In other words, until the asthma is stabilized, the type or amount of medication may be increased initially. After it has been stable for some time, your doctor may then reduce the dosage so that your child just needs to get the bare minimum of medication to stay stable. Your kid's long-term treatments may be increased to a higher dose or include additional medications if your doctor eventually deems that your child is taking a short-acting medication too frequently. Depending on each child's response to treatment, overall growth and development, seasonal changes, or changes in activity levels, this step-by-step strategy may produce shifts up or down over time. Medications for long-term control. Long-term control or maintenance medications are usually taken daily. Types of long-term control medications include 1. Inhaled corticosteroids. They are the most commonly used long-term asthma control drugs for children under the age of 5, as well as the preferred treatments according to the National Asthma Education and Prevention Guidelines. Easily administered inhaled corticosteroids available to infants and preschool children include budesonide, fluticasone, and glucometazone. Number 2, you have leukotriene modifiers. When an inhaled corticosteroid treatment alone fails to produce stable asthma management, leukotriene modifiers may be added to a treatment regimen. 3. A corticosteroid treatment plan may also include the addition of a long-acting beta agonist and inhaled medication. 4, you have cromolyn, which is an inhalation medication that suppresses inflammatory processes and can be used in conjunction with inhaled corticosteroids to treat certain conditions. Compared to other long-term control medications suitable for young children, this treatment has less data supporting its efficacy. Number 5, only when other therapies fail to control an asthma attack are oral corticosteroids administered. You have medication delivery devices. Most asthma medications are given with a device called a metered dose inhaler that requires a correctly timed deep breath to get medications to the lungs. Attachments for metered dose inhalers and other devices can make it easier for children under age 5 to get an appropriate dose. This device includes, you have the valved holding chamber with mask, and you have your nebulizer. A nebulizer, which is more common, turns medications into a fine mist your child breathes in through a face mask. Young children often need to use a nebulizer because it's difficult or impossible for them to use other inhaler devices. Thank you for watching. Thank you for joining us. Do it to subscribe, like, and comment your thoughts below. As always said, this video is not to directly help you treat asthma, but it may help you manage it and also give you a clue on what to do. The best thing is always to see your doctor. Thank you. Bye.